Hello everyone, my name is Dr. Joel Rosen. I am an adrenal burnout recovery ninja, and I want to welcome you back to another edition of your Adrenal Fix. Today I want to talk to you about how to have more energy. This is going to be a little bit different than what I usually talk about. It's going to be a little bit outside the box, but I had a case study come in this morning, and she had been doing fantastic up until when she hit the wall, and I want to explain to you exactly how that can impact your ability to have more energy. The best way to define metabolism is when you eat food and it gets converted to energy. So if you have an energy problem, you don't have energy when you first wake up, you're not bounding out of bed, you don't have energy to attack your daily to-do lists, to get the things done that you need to get done, you're not motivated, you're crashing in the middle of the day, then you are not converting food into energy because you don't have the energy. And so another way of saying that is you have a metabolic problem, because metabolic is defined as converting food into energy. So you have a metabolic problem, and let's try to figure out what those metabolic problems are. It's not the fact that you don't have enough Red Bull in you, or you don't have enough of Red Line in you, or you don't have five-hour energy in you, or you don't have enough caffeine in you. Those are all junk things that are going to really, at the end of the day, they're going to deplete your energy savings account. They're not going to rebuild that. Caffeine can be used in moderation, but it's usually not used in moderation, or it's used with neurotoxins, sweeteners, chemicals, artificial stuff, with hormone infested dairy, and just usually it's the crap that's put in there. But don't lose the message in that typically it's not the shortage of these energy potions that you have in your body that's not giving you the energy that you're looking for. So if you have metabolic problems, what could they possibly be? I've talked about them before. I've talked about having blood sugar imbalances, waiting too long between meals, missing meals, having too much sugary foods. And in these cases, typically your blood sugar is going to be lower than the optimal 85 to 99. You're going to be somewhere in the 65 to 85 range. If you're above 100, it means you're having too many carbs, too many sugary foods, and too much absolute amount of foods, and you're having insulin resistance, and that's going to cause energy problems as well. Potentially there's anemia, so you may be having an absorption issue, you're not absorbing enough nutrients, you're not maturing red blood cells, and you have a B12 or folate deficiency, or you may even have an iron deficiency, and that's going to result in anemic tendencies, and you're not going to produce enough energy, and you're going to be exhausted that way too. The last thing I want to talk about, though, is infections. So infections are in everyone, believe it or not. We all have had viruses, we have all had bacteria infections, potentially we've all had fungus, and potentially we've all had mycotoxins, or we've had other pernicious things like potentially we've had parasites. We all live, breathe, and are part of the environment. We're going to have these toxic things in our body, and ultimately it's those that have no energy, that have normal blood sugar and have normal oxygen levels, that have infectious processes that are draining your adrenal glands, and you have no idea. So how would you know? First of all, you need to look at your blood work. Your white blood cells should be between 5 to 8. If I see any white blood cells that are above 8, then typically it's an acute outbreak of some kind of bacteria infection. If I see it below 5, then potentially it's a virus that's been there for a chronic amount of time that's draining your immune system. 80% of your immune system is in your gut, so potentially we need to fix the gut in order to affect the infection or the infection-like processes. Let me tell you about a patient. She was coming in, we did a repair, we did a cleanse, we avoided foods, gluten, dairy, soy, egg. We did some supplements to try to rebuild her gut, and then I retested her thyroid antibodies, and they didn't change. They went from 79 to 72. It only dropped 7 points, and it should be below 34. So she was positive. She is Hashimoto's, and she is frustrated because she doesn't know what's going on. We looked at her white blood cells, and her white blood cells were elevated. They were above 8. In fact, they were above 10, and her neutrophils were really high. And so she had some kind of hidden infection that traditional mainstream lab reporting diagnoses are going to miss. And so sure enough, she went to her dentist and she had a huge, massively infected tooth. And that's a problem because that's going to drain your adrenal glands. And she didn't even know it. And there was some necrosis underneath the tooth. And ultimately, potentially whether the tooth is drained or the inflammation is drained or it's pulled or it's replaced or it's dealt with, it's always going to be draining the adrenal glands. So infectious teeth, cytomegalovirus, Epstein-Barr viruses, herpes viruses, all of these viruses are going to drain your adrenal glands. And don't put your head in the sand like an ostrich would and say, you know what, I had it a long time ago, but it's not draining me now, it's out of my body. If you're watching this video and you're suffering with a lot of adrenal problems, you have no energy, and you know in the past you've had a virus, I pretty much guarantee that when your immune system is stressed, much like a cold sore, it comes out and it shows its ugly self, and then it goes away for a year, and then it comes out, and you know what's happening is you're not dealing with the infectious process. So cleaning up the gut is helpful. Helping supply healthy bacteria in the gut, short chain fatty acids, is very helpful. Helping getting different probiotics, prebiotics, and gut repair protocols are going to be helpful. Liver detoxing is going to be helpful, whether that be coffee enemas or liver botanicals, or even how about infrared to detoxify. All of these things are going to be great. We also do bioenergetic testing, and that will help identify and remove toxic exposures as well. The reason this video is a little different today because you need to realize that at the end of the day, these tough cases, these people that have no energy, no matter what they do and how much medications they take or how many tests they go to and how many doctors they see, how many times they're told that nothing is wrong, ultimately you're dealing with some kind of infectious issue, and that has to do with the gut. So hopefully you got a little bit out of this today. Again, keep in mind that you have a metabolic disturbance. I'll get into other secondary effects of these metabolic disturbances, and those are neurological consequences. So things like not being focused, not having attention, not being steady on the feet, balance is off, having musculoskeletal pain like fibromyalgia pain, having brain fog. A lot of those happen to you guys already, and that's the consequence of having these infectious like processes, is the fact that your inflammation is not allowing you to convert food into energy, and that's resulting on the implication on your neurological system. So again, my name is Dr. Joel Rosen. I hope you enjoyed another edition of your Adrenal Fix. Please give me a thumbs up, a share, or a comment if you enjoyed what you heard. And be sure to check out my website at adrenalfatiguesociety.com. Look forward to helping you in your adrenal nightmare. Thank you so much.